So if you remember what we've mentioned so far in the skeletal muscles anatomy, if you remember the quick introductions that we've had last class, if you remember, a muscle contraction is simply the shortening of the length of a muscle. If you remember, any muscle has at least 2 points of attachment. Those are going to be the origin of the muscle and the insertion of the muscle. If you remember, by definition, what's the muscle contraction? It's the shortening of the length of the muscle. So if I'm shortening the length of the muscle, what this will result in, I will have one point dragged towards the other point. Most likely it's going to be the insertion going to be moving towards the origin. And when this takes place, the muscles are going to be passing over a joint, for example. So if this is a humerus, like this, and this is the radius and ulna, and let's say this is the biceps. So if the biceps is passing in front of my elbow joint, which is the articulation between the humerus and the radius and ulna, pulling the insertion towards the origin gonna be allowed you to move the forearm in this direction. And this movement that I will be allowing is gonna be flexion of my elbow. This is simply speaking what we're gonna be discussing today. We're gonna be mentioning the different muscles, their origin insertion, and what action would they allow. So looking first at some muscles that are attached to the skin responsible for facial expression, which are mainly located in the head and neck. So the first muscles that we're looking at today, it's called the epicranius. Epi means on top of. Cranium, it's the cranium, the bones of the skull. So we're looking here at a muscle that has two parts, an anterior part of the muscle, a posterior part of the muscle, and both are connected by a sheet-like tendon. If you remember, what do we call a sheet-like tendon? It's my aponeurosis. So the epicranius is formed of an anterior belly, posterior belly, and connecting them together, I have a sheet-like tendon. This is called my gala aponeurotic. The anterior belly, if you see on here, it's related to the anterior aspect of my head. And remember, something related to the anterior aspect of the head, it's frontal. So we call this is my frontalis. Frontalis is the anterior portion of the epicranius. And the posterior portion, if you remember, something related to the posterior aspect of the head is occipital. So we call this part of the epicranius, it's my occipitalis. So I've got frontalis anteriorly, occipitalis posteriorly, and the two are connected together by a sheet-like tendon. This is my gala aponeurotic. Gala aponeurotic. Gala aponeurotic on here. So what do you think is going to be the action of the frontalis, the anterior part of my epicranius? What do you think? I'm telling you that it gets inserted in the skin of the forehead, and it gets its origin from the gala aponeurotic. So I'm getting the origin here from this point. This is my origin, and I get inserted in here in the skin of the forehead. So what is by definition a muscle contraction again? It's the shortening in the length of the muscle. So if I'm shortening the length of the muscle, putting the insertion towards my origin, what do you think is going to be the action of the frontalis muscle of the gallop of the epicranius? Raises the eyebrows and wrinkles the skin of the forehead. You see on here, wrinkling the skin of the forehead, raising the eyebrows. What is due with this on here? This is the contraction of my frontalis of the epicranius. So frontalis muscle is going to be pulling the skin of the forehead upwards, elevating the eyebrows and wrinkling the skin of the forehead. Moving on to another muscle. This time it's located around the eye on here. It's a circular muscle. So if you remember, a circular muscle is what we call orbicularis. And orbicularis related to the eye, and something related to the eye is oculus. All right. So oculo, it's related to the eye. So we have a circular muscle on here that is related to the eye. This is my Orbicularis Oculi. So it's a circular muscle. So when it contracts, it's going to be squeezing like this. So what do you think is going to be the action of the Orbicularis Oculi? So when I contract, you're blinking, and it allows you to close your eye. You blink, and in the same time, it allows you to close your eye. So again, what do we call this muscle on here? A circular muscle around the eye, Orbicularis Oculi. Orbicularis Oculi. We can see another muscle on here, another circular muscle, but this time it's around the oral orifice, around the opening of the mouth. So what do you think is going to be the action of the orbicularis oris? Orbicularis, circular, and oris, oral means related to the mouth. So I'm looking here at a muscle surrounding the opening of my oral orifice. So when I contract this muscle like this, here, I'm pursing my lips, and allows you to close as well your oral orifice. That's why we call this muscle the kissing muscle, because it allows you to purse your lips. Kissing muscle. So again, seeing two circular muscles. Orbicularis oculi allows you to blink, allows you to close your eye. Orbicularis oris allows you to purse your lips, close the oral orifice, and that's why we call this as my kissing muscle. Kissing muscle. You can see on here a muscle that gets its origin from the zygomatic bone and will be inserted in the angle of the oral orifice. Actually, we've got two on here. Two muscles that you see on here, getting their origin from the zygomatic bone and the maxillary bone, and will be inserted in the angle of the mouth. This is called the zygomatics. So for us, both of them are zygomatics. So the large one, it's called the zygomaticus major. This is the zygomaticus major, and this would be zygomaticus minor. But for us, both of them are going to be zygomaticus. That's it. Zygomaticus. So if I'm telling you that I've got the origin from the zygomatic bone and I am inserted in the angle of the mouth. So what do you think is going to be my action? Again, how would I know the action of a muscle? Muscle contraction is shortening in the length of the muscle. So you're pulling one side towards the other. So what do you think is going to be the action on here? I am putting the angle of the mouth up towards my zygomaticus. So smiling. So the smiling muscle on here, this is my zygomaticus. So I'm putting here the angle of the mouth towards my zygomaticus bone. So it allows me to smile. Smile. This is my zygomaticus. Again, we have two, zygomaticus major and zygomaticus minor. Those two on here. This one and this one. Zygomaticus major and zygomaticus minor. On the side of the cheek, we've got a muscle. This is my buccinator or buccinator. The buccinator muscle on here. You can see a small part of it on here. This is my buccinator muscle. And if we're looking closer, to the buccinator muscle, you will see it's going to be attaching itself to the bones of the upper jaw and lower jaw. But the main bulk of the muscle is actually directed towards the inside. So the main action of the buccinator muscle on here is to compress the food inside the oral cavity. So when you're chewing, you will find yourself tending to accumulate the food on the side of your teeth. So inside your cheeks. So what compresses the food while you're chewing to push it back again into the inside of the oral cavity for you to keep moving and breaking it down, it's gonna be your buccinator muscle. So the buccinator muscle main action is to compress the food inside the oral cavity. This is one thing. The other thing, to create a negative and positive pressure. So if you are willing to whistle, for example, what you're doing is you're pushing the air out, but in order to push more air out, you're going to be compressing your cheeks. So you're going to be contracting the Vaccinator muscle. When I contract the Vaccinator muscle, I squeeze more air out for me to be able to whistle. Also, when suckling, I'm contracting those muscles to create a vacuum inside my oral cavity to allow sucking. So Vaccinator muscle action would be to help with chewing by compressing the food inside the oral cavity and prevent it from being accumulated between your teeth and your cheek. Also, it's going to be responsible to allow suckling and whistling. All right, so again, what do we call this muscle on the side of the cheek? It's my vaccinator or vaccinator muscle. Moving on to another muscle that you can see on here. It's the muscle that gets its origin from my zygomatic arch, both zygomatic bone and process, and gets inserted down here in the angle of the mandible. So this is a point of origin, and this is a point of insertion. So what do you think is going to be the action of the masseter? This is my masseter on here. What do you think is going to be the action of the masseter? Elevation of the mandible. So I'm putting the mandible up, and this will allow me to close the mouth and will allow me to chew the food. All right, allowing chewing, and allowing the elevation of the mandible, which allows me to close the mouth. All right, so again, we've got this muscle on here. This is my masseter. Masseter gets its origin from the zygomatic arch, zygomatic bone and process, and gets inserted down in the angle of the mandible. When it pulls on the angle of the mandible, it's going to be allowing the elevation of the mandible, closing the mouth, and allowing chewing to take place. Another muscle that you can see on here, it's a flattened muscle. This is called the Platysma. Platysma. If you see on here, the Platysma muscle gets its origin from the clavicle and will go to be inserted in the lower margin of the mandible. See on here, this is my platysma. It's a thin superficial muscle on here in your neck. It's very delicate, very thin. You don't even feel any bulking of it. So what do you think is going to be the action? If I am getting my origin from the clavicle, if I'm getting my origin from the clavicle, and my insertion is in the lower margin of the mandible. So what would I do here? I'm putting the mandible down. I'm putting the mandible down. So I'm depressing the mandible. So what's going to be an action here of the platysma? As you see, I'm getting origin from clavicle, and I'm going up to be inserted in the lower margin of the mandible. So I'm pulling the mandible down. What do we call this movement of the mandible? It's depression of the mandible. Depression of the mandible. All right, depression of the mandible. We're looking on here. What other action do we have for the platysma? Platysma also gonna allow me to stretch the skin of the neck. So you see on here, this is the platysma contracting. I'm allowing the stretch of the skin of the neck. And this will allow you to express the facial expression for horror and fright. So it's also responsible for facial expression for horror and fright. Platysma. Platysma. All right, so again, what muscle are we looking at in here that gets its origin from the clavicle and will be inserted up in the lower margin of the mandible? What do we call this muscle again? It's my platysma. Platysma. Any questions? Any questions? All right, so moving on to a very important muscle that we are looking at here in the neck. A muscle that gets its origin from the manubrium sterni, the manubrium of the sternum, and the medial part of the clavicle, and will be inserted all the way up in my mastoid process. If you remember, the mastoid process is this bulky, bony eminence located behind your ears. So bulky, bony process that is located behind your ears, this is the mastoid process. So you've got a muscle on here that gets its origin from the manubrium of the sternum, from the medial part of the clavicle, and will go up to be inserted in your mastoid process. So what do we call this muscle? We're gonna call the muscle according to its attachments. So we call this is my sternocleidomastoid. Sternocleidomastoid. This is the muscle that gets its origin again from the manubrium sterni, manubrium of the sternum, the medial 1/3 of the clavicle, and will go to be inserted in the back of the head in the mastoid process. So what do you think is going to be the action here? Try to imagine I'm putting the mastoid process towards my sternum. I'm putting the mastoid process towards my sternum. So this is my head like this. I'm attached to the mastoid process and putting the mastoid process to move towards the sternum. rotation of the head from side to side. So if you are contracting one side at a time, you're gonna allow the rotation of the head from side to side. So again, if I'm contracting one side at a time, sternocleidomastoid gonna be putting the mastoid process to move towards my manubrium sterni. So each time I contract one side, what's gonna happen? It will be rotating my head from side to side. All right, we don't call it movement of the head, we call it a rotation of the head from side to side. So again, what's going to be the action of the sternocleidomastoid? If you contract one side at a time, you're going to be rotating the head from side to side. What if I decided to contract both sides at the same time? So I'm pulling the two mastoid processes down towards my sternum. So two mastoid process, I'm putting the two mastoid processes towards my sternum. So what is this movement? If you're putting both sides in the same time, what do we call this movement? Remember, this movement is taking place along sagittal, right? And did I increase or reduce the angle of the joint when I do this? I did reduce the angle of the joint. So what do we call this movement? It's neck flexion. So again, sternocleidomastoid. When you contract one side at a time, this allows me to rotate my head from side to side. If I contracted both in the same time, this allows neck flexion. Any questions? So what we're looking at in here, it's my sternocleidomastoid, and you see it's underneath the platysma. So the platysma is much more superficial. This is my sternocleidomastoid. It gets its origin from the manubrium sterni, medial 1/3 of the clavicle, and will go to be inserted in the mastoid process, as well as part of my occipital bone. So when I contract this muscle again, if I contract each side at a time, this will allow the rotation of the head from side to side. If you contract both at the same time, this allows neck flexion. So I've got a question here. Does the platysma assist in this movement? It plays like a very minor role because it doesn't have like much muscle fibers to increase the force to allow the flexion of the neck. All right, it plays a limited role in terms of neck flexion, but it even plays a very minimal role in terms of depression of the mandible, because the depression of the mandible to open, it's taking place along with the gravity, so it can simply drop. So that's why it's not a strong muscle to play a major role. But the major action the platysma is performing is to stretch the neck of, to stretch the skin of the neck, and facial expression for horror, expressing horror and fear. All right, this is going to be the main action. It even plays a very limited role in terms of depressing the mid. All right, so again, Sternocleidomastoid, I'm getting my origin from manubrium of the sternum, medial 1/3 of the clavicle, and I'm going up to be inserted in the mastoid process. This muscle allows head rotation if you're contracting each side at a time, and allows neck flexion if you contracted both sternocleidomastoids in the same time. All right, moving on to another muscle that also can perform its action on the neck. This time it's going to be located in the back. All right, so you are looking here at this diamond-shaped muscle. You see on here, this is called the trapezius. This is called the trapezius muscle. We're looking on here. The trapezius gets its origin from, remember this bony eminence in the back of your head? What do we call this bony eminence in the back of my head? This is my external occipital protuberance. Also, it gets its origin from the external occipital crest, part of it. Superior buccal lines, all this from the occipital bone. So simply speaking, it gets its origin from the occipital bone. And you see on here, it's gonna keep moving down, getting its origin from the spinous processes of the cervical and the thoracic vertebrae. All this is the origin of my trapezius. All this is my origin of the trapezius. And it's going to be inserted down here and up here towards the spine of the scapula. So we're looking here at the trapezius. We've seen the origin is coming from external occipital crest, protuberance, buccal lines, occipital bone, and the spinous processes of all the cervical and the thoracic vertebrae. All this is my origin, and the insertion for the muscle here, it's gonna be the spine and the acromion of my scapula. So what's gonna be the action of the trapezius? What's gonna be the action of the trapezius if we're looking at a muscle like this? In order to tell the action of the trapezius, you need to tell me what part of the trapezius, because it's a very extended muscle. So what part are we looking at? So let's start first with the upper muscle fibers. So what do you think is going to be the action on here? I am pulling the spine of the scapula towards my external occipital protuberance. What do you think is going to be the action in here of the upper muscle fibers of the trapezius? See, muscle fibers are going to be pulling the scapula up towards my head. So what's going to be the action? Elevation of the shoulder. Elevation of the shoulder. Very important to mention what movement is going to be taking place. You need to mention what is the movement that is taking place. So I'm putting the scapula up. What do we call this movement? It's elevation of the shoulder. Elevation of the shoulder. All right, is this clear? Too fun? So I'm putting the scapula up. This is elevation of the shoulder. What if I'm telling you, and when you go to the gym, you will see people training, they hold the bar like this, and they are moving their shoulders up, 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 up. So what they are training is actually the upper muscle fibers of the trapeze. Does this make sense? All right, so moving on to another part of the trapezius, it's going to be the middle muscle fibers. Middle muscle fibers on here. So the middle muscle fibers, what do you think is going to be the action of those middle muscle fibers? So I'm putting the spine of the scapula towards the back on here. I am putting the scapula towards my back. Is this a flexion, extension? Is this flexion, extension? No, I'm just putting the scapula backwards. This is what we call the retraction of the scapula. Retraction of the scapula. It's not an angular movement. The scapulae are sliding posteriorly towards the midline. So we call this as retraction of the scapula. Retraction of the scapula. All right. Muscle fibers on here. Let me remove this. The lower muscle fibers of my trapezius, you see, they are traveling up and they move to be inserted like this. So when I pull the spine of the scapula downwards like this, along in the same direction as the muscle fibers, lower muscle fibers of my trapezius, what action would I be performing? Try to imagine you have the scapula, you're pulling the scapula like this. So if I was inserted, this is a very good one, Theodore. So if we're looking at this muscle and it was attaching the spine of the scapula, you see on here, in the lower margin. So if it was attaching the spine of the scapula from its inferior surface, yes, at this point, when I contract this muscle, it's going to be pulling the scapula down. But you see on here, those are traveling to be inserted in the upper surface, in the superior surface. So you see, I'm inserted in here, and the muscle fibers are going to be moving down like this. So try to imagine the movement that will be taking place, dragging this point towards this point. I am putting this point downward. So what movement would I be performing? If this is my scapula, I'm inserted in the upper surface or the superior surface of the spine of the scapula, and I am putting it down. It's different than if you are inserted in the lower surface of the spine. So if you are inserted in the lower surface of the spine, when you pull on it, it's going to be moving down, deep pressure. But if you are inserted in the upper surface, when you pull it down, it rotates. You see on here, when I'm putting on the upper surface, this surface rotates. This is the same concept. Can you imagine this? Can you imagine this on here? I am putting this point downwards in this direction. So this point is moving. This line on here, it's going to be moving towards this point. So when it moves, is it going upward or downward? Is it located? This point, this side of the line is going down, but this side of the line is going up. So it's going to be like this. So I have moved like this. So when I pull on the superior surface of the spine of the scapula, downward, being attached to the superior surface of the spine, I will allow the rotation of the scapula. And when I rotate the scapula, this will allow me to move my arm above my head. All right, so you see on here, can you imagine what we did just describe? Can you imagine what we did just describe? Everybody? Anybody has a problem here understanding how this rotation takes place? All right, great. So again, what's gonna be the action of the trapezius? It's according to what muscle fibers are we contracting? Are we contracting the upper muscle fibers? Elevation of the scapula, elevation of the shoulder. Middle muscle fibers, retraction of the scapula. Lower muscle fibers, rotation of the scapula. What if I fixed the scapula? So the scapula here, it's not moving, it's fixed. And I'm contracting those muscle fibers to pull on the external occipital protuberance. So I'm starting from this position, flexed neck, and I'm pulling the external occipital protuberance backwards towards my scapula. So what action am I performing on here? I'm pulling the external occipital protuberance backwards. I'm performing neck neck extension. Neck extension. So again, what action would I be performing by the trapezius? Many actions that we've seen on here. Contraction of the upper muscle fibers will allow elevation of the shoulder. Middle muscle fibers will allow retraction of the scapula, and the lower muscle fibers will allow the rotation of the scapula. If you fix the scapula is not moving, you're pulling on the external occipital protuberance, you're going to be allowing extension of the neck extension or head extension. Excuse me. All right, so moving on to another muscles that we see on here. This is going to be my muscle, other sets of muscles that will be responsible here to allows the movements of the arm. So the first muscles that we're looking at that allows the movement of the arm is going to be the pectoralis major. Pectoralis major, as you see, it gets its origin from the medial half or 2/3 of the clavicle, from the manubrium sterni, angle of the sternum, the body of the sternum, and the muscle fibers are traveling down to be inserted in the shaft of the humerus. So the muscle fibers are traveling down and laterally and upward to be inserted in the anterior aspect you see on here of the humerus. This is my pectoralis major. So what do you think is going to be the action here of the pectoralis major? This is my origin. This is my origin. And this is my insertion on here in the shaft of the humerus. So I'm putting the origin, I'm putting the insertion towards the origin. So what do you think is going to be the action? I am putting my arm towards my chest. So what action when you pull the humerus towards your sternum? What is the movement that is taking place in here? What do we call this movement? What do we call this movement? A forward movement of the arm. Forward movement of the arm. What is this movement? It's flexion of the arm. Flexion of the arm at the shoulder. Flexion of the arm. What else can you perform on here? See, I am pulling my arm towards my chest. I can also be putting my arm towards my chest, not only forward, but towards the midline. I am adding my arm to my body. What do we call this movement? Where you're going to be adding the arm to the body, and you're putting the arm towards your midline of the body. What do we call this again? This is adduction of the arm. So what are the main actions of the pectoralis major? We've seen it allows you to move the arm towards your body. Adduction of the arm also allows you to pull the arm forwards. It's gonna be flexion of the arm. So what are the main actions here for pectoralis major? Flexion and adduction of the arm. So that's why if you go to the gym to train your pectoralis major, what exercise would you be performing? Bench press. Bench press. So what we're doing here, we're doing both. Adduction. See, I'm moving my arm towards the midline. Adduction. And at the same time, it's flexion. Some exercises will only focus on one, adduction, or only flexion. All right, but the best exercise and the most widely used is going to be the ones that will allow you to perform both flexion and adduction, bench press. Those are the main actions of the pectoralis major. All right, so looking at another muscle here that will also allow the movement of the arm. This muscle is getting its origin from, as you see on here, the sacrum, the ilium crest, from the spine in the lumbar region and the thoracic region. All this is the origin of the Latissimus Dorsi. And the muscle fibers of the Latissimus Dorsi are going to be moving up and forwards. The Latissimus Dorsi you see on here its muscle fibers are traveling upwards and will be inserted in the anterior aspect, you see, of the humerus. It's inserted in the anterior aspect of the humerus. So what do you think? When I'm pulling the anterior aspect of the humerus towards my iliac bone, what action? And towards the midline of the body in the spine, what action am I performing when I pull the arm towards my midline of the body backwards towards my spine? So what action? I'm pulling the arm backwards. What do we call this action? It's arm extension. So the prime mover for arm extension, it's the Latissimus dorsi. You see on here, I'm going up to be inserted in the anterior aspect of the arm for me to pull the arm backwards. So this is arm extension. What else can it be performing? You see, I am putting the arm towards the midline. I'm putting the arm towards the midline. I can pull the arm towards the midline. So I'm helping with adduction of the arm. I'm helping with the adduction of the arm. And you see on here, if this is my humerus, just look at this pencil that I'm holding. And I'm inserted like this. I can pull towards the midline, adduction. I can pull backwards, extension. But I can also perform some rotation. So I can pull the arm to medially rotate. You see on here, I can pull the arm for it to, rather than only extension or adduction, I can also allow medial rotation of the arm. All right, do we need to know all the actions? You need to know the actions stated on your list. So here we're discussing many other actions that might not be on your list, but what are required from you for the upcoming lab exam are only the ones stated on the list. All right, so again, what is the action of the latissimus dorsi? The most important, the single most important action is gonna be arm extension. So what is gonna be the relationship between the pectoralis major and the latissimus dorsi in terms of arm flexion and extension? Would they be antagonist muscles? They are opposing one another, or would they be synergists? They are aiding one another. What do you think? Adding force to one another. What was the action of the pectoralis major again? I'm putting the arm forwards. So it was flexion. And how about the latissimus dorsi? I'm putting the arm backwards, arm extension. So what do we consider those two muscles as? Would they be considered as synergist muscles or antagonist muscles? What do you think? Antagonists, they are performing opposing actions. One is flexion, one is extension. One is flexion, one is extension. So they are performing antagonist actions. They are antagonists. Looking at another muscle that will also allow the movement, but they are synergists, yes, as Theodore says here. They are antagonists in terms of flexion extension, but both of them are helping with the adduction. So yes, so they are synergists in terms of adduction of the arm. Yes, exactly. So two muscles might be antagonists in one action, but synergists in a different action. All right, so you don't consider whether the muscles are antagonists or synergists for all actions. We consider it by action. It's not a general rule that will be applied to all actions performed by those two muscles. All right, so looking here at another muscle, that's going to be my deltoid. Remember, deltoid, delta means a triangle and oid looks like a triangular shaped muscle that gets its origin from the lateral 1/3 of the clavicle, from the acromion, and from the spine of the scapula, and will be inserted, if you remember, down in the mid shaft of the humerus at an elevated point. We call this is my deltoid tuberosity, if you remember. So what do you think is going to be the action here of all the three parts of the deltoid muscle? I am putting the lateral aspect of the arm towards my clavicle and scapula. I'm putting the lateral aspect of the arm towards my clavicle and scapula. So what action would I be performing on here? It's abduction of the arm. I am moving away from the midline. So the prime mover for arm abduction is going to be the deltoid muscle. Deltoid muscle. All right. Questions? All right, so we can have a break for 10. We come back, discuss more about the skeletal muscles. In the second half of the session today, we're gonna be discussing the muscles that will allow the movement of the forearm, as well as wrist joint. And we're going to discuss the abdominal muscles. We're going to have a brief introduction of the muscles that will allow the movements of the thigh in the lower limb. All right, so we can have a break for 10 now, and